Okay. Let me see. I'm just going to try and see if this is working. Okay.
It says YouTube on my side.
It is saying,
Mhm.
okay. On YouTube, okay. This thing is a little funny sometimes, so let's see. That started. Notifications. Videos. Oh boy, don't tell me it has not started yet. Yeah. All right, it is saying it is live, so I will continue. मला काही दिसत तरी नव्हतं. Okay. Anyway, we are recording the session. Top it is saying it is live, so I'm hoping it is live. नमस्कार. आज तारीख जानेवारी 14, 2024. मराठी विश्व कम्युनिटी कट्टा 2024 च्या मालिकेत पहिल्या मालिकेत we have Dr. Manoj Shahane with us today. नवीन वर्ष सुरू झालाय, सो मला नवीन वर्षाच्या शुभेच्छा सगळ्यांना द्यायलाच पाहिजेत. सो हॅपी न्यू इयर एव्हरीबडी. आणि संक्रांती येत आहे व्हेरी शॉर्टली टुमॉरो. सो संक्रांतीच्याही सगळ्यांना खूप खूप शुभेच्छा. आणि होपिंग एव्हरीथिंग वर्क्स आउट वेल दिस इयर फॉर एव्हरीबडी. नवीन वर्ष आला की सगळ्यांच्या मनात काहीतरी धोरणं असतात. हेल्थ वाईज, if you are diabetic, how will I control diabetes? If you are a health freak, or you're a runner, you want to see how many marathons you can run, 5Ks you can run. Health conscious लोक होतात लगेचच की मी रोज योगा करणार, मी रोज चालायला जाणार बाहेर, फलाना ढिकना. But lot of people normally forget about one very important topic, not only your spiritual well-being, health well-being, but also your mind. How to keep your mind active as you progress in age every year. So yeah, खूप इम्पॉर्टंट टॉपिक बद्दल आणि इन्फॉर्मेशन द्यायला आज आपल्या बरोबर आहे डॉक्टर मनोज शहाणे. आणि welcome Manoj, but like a disclaimer to everybody, and Manoj is also going to repeat the disclaimer. This is a very informational topic. मला मनोजच्या एका फेसबुक पोस्ट वरून वाटलं की नाही आपण हा टॉपिक ठेवायला पाहिजे, आणि दॅट इज वाय वी इन्व्हायटेड हिम टू टॉक हिअर. पण very important to keep up with this, take this information as information, and please be very much in touch with your own health provider for all questions and answers regarding the topic Manoj is going to be talking about. I have known Manoj only for the last 2-3 years. So Dr. Manoj Shahane, namaskar and welcome
Namaskar.
to MV Community Katta. मला खरंच तुझ्याबद्दल जास्त माहित नाहीये. आणि I wanted to give the opportunity to you to talk about yourself a little bit, and then we can jump into the topic.
Sure. Thank you so much, Anaga. सर्वप्रथम मी मराठी विश्वाच्या आणि जे सगळे आज हा टॉपिक ऐकतायत त्यांना सगळ्यांना 2024च्या हार्दिक शुभेच्छा. त्यांना हे नववर्ष खूप आनंदाचे आणि समाधानाचे आणि हेल्दी जावो अशी माझ्याकडनं मी सगळ्यांची विशेष करतो. आणि सगळ्यांना मकर संक्रांतीच्या हार्दिक शुभेच्छा. आय नो उद्या मकर संक्रांत आहे. आणि फ्यू थिंग्स अबाउट माय सेल्फ. मी सगळ्यांना बोर करणार नाही माझ्याबद्दल काही सांगून, पण आय एम अ फिजिशियन. ओरिजिनली मी मुंबईचा आहे. मी KEM मधनं MBBS करून तिथे MD अॅनेस्थेशिया करून अमेरिकेत आलो 1996 ला. आणि आय बीन प्रॅक्टिसिंग अॅनेस्थेशिया फॉर अबाउट 27 years. अनघाचं आणि माझं कनेक्शन झालं मागच्या नोव्हेंबरमध्ये, वेन आय हॅड पुट आउट अ फेसबुक पोस्ट फॉर माय डॅड. तर त्यांना ही हॅज ॲडव्हान्स्ड डिमेन्शिया आणि ही इज 86 years old. आणि it's pretty hard on the family, on me and on my sister, on my mother. तर तेव्हा ती पोस्ट बघितली अनघाने आणि तेव्हा तिने मला विचारलं की ऍज अ डॉक्टर इफ यू हॅव एनी इन्फॉर्मेशन ऑर एनिथिंग दॅट कॅन हेल्प द कम्युनिटी, आपण ह्या विषयावर काही बोलू शकतो का. सो हा आमचा एक खूप माफक प्रयत्न आहे की सगळ्या लोकांना थोडीशी जरी इन्फॉर्मेशन आपण देऊ शकलो या माध्यमातनं तर खूप फरक पडेल लोकांच्या आयुष्यात होपफुली. आणि ऍज अनघा सेड की आय वुड डू द सेम डिस्क्लेमर की दिस इज मोर इन्फॉर्मेशन. आय एम नॉट अ न्यूरोलॉजिस्ट ऑब्विसली. ज्या लोकांच्या फॅमिलीमध्ये डिमेन्शिया किंवा तत्सम डिझिजेस आहेत आणि त्यांचे जर डॉक्टर्स असतील त्यांचे, तर दे शुड ऑब्विसली फॉलो देअर ओन गाईडलाईन्स, ओन ट्रीटमेंट. पण दिस इज व्हेरी इन्फॉर्मेटिव्ह आणि मला वाटत नाही की यातलं कुठलाही आजच्या जे इन्फॉर्मेशन आपण शेअर करणार आहोत दॅट विल ओनली हेल्प एव्हरीवन. सो दॅट्स प्रिटी मच अबाउट मी. पण आय थिंक आपण हा मुद्दा आणि हा विषय खूप खूप खोल आहे. सो आपण या विषयावर डिस्कशन चालू करूया. आणि आय वुड रिअली थँक मराठी विश्व आणि अनघा फॉर ब्रिंगिंग सच अ व्हेरी इम्पॉर्टंट टॉपिक टू द फोरफ्रंट. आणि what I'll try to do is most of the discussion I'll have in English. कारण जरी आपण मराठी विश्वाच्या कट्ट्यावर गप्पा मारतोय, बरीचशी माहिती इंग्लिशमध्ये सायंटिफिकली प्रूव्हन आहे. आणि मी जी जी माहिती आज देतोय त्याचा मी खूप रिसर्च केलेला आहे गेल्या काही महिन्यात. आणि टू द बेस्ट ऑफ माय अंडरस्टँडिंग दॅट इज बिन वेटेड, सायंटिफिकली प्रूव्हन. सो मी जेवढी शक्यतो सगळी जी माहिती इंग्लिशमध्ये देता येईल, सो आपल्या मराठी बांधवांना, भगिनींना आणि इतर भाषिक लोकांना सुद्धा ही माहिती कळू शकेल. आणि म्हणून आम्ही याचं रेकॉर्डिंग करतोय. सो एक दुसरा मुद्दा असा आहे की आज हा विषय इतका सखोल आहे आणि खूप डीप आहे, त्यामुळे आम्ही आज या विषयावर चर्चा फक्त करणार आहोत. इट्स अ टॉक. प्रश्न उत्तर आपण करत नाही आहोत आज. पण जर कोणाला जर तुम्हाला आजचा विषय आवडला किंवा आजचं डिस्कशन आवडलं किंवा आजचा टॉपिक आवडला तर कृपया प्लीज अनघाला किंवा मराठी विश्वला मेसेज पाठवा. आपण पुन्हा त्याचा पार्ट 2 किंवा प्रश्नोत्तर किंवा क्वेश्चन आन्सर सेशन पुढच्या वेळी करू शकतो. सो हॅव्हिंग सेड दॅट, आपण नमनाला गळावर तेल घालून आता या विषयाला सुरू करूया. सो आय थिंक विल टॉक अबाउट द टॉपिक that I have labeled as dementia prevention. So I'm
Thank
going to share my screen here because I've created certain amount of slides. जर माझा चेहरा दिसला नाही तरी चालेल, पण हे विषय महत्वाचा असल्यामुळे आपण या स्लाइड्स मध्ये जरा थोडं लक्ष घालूया. सो we'll start with what I've labeled as dementia prevention. Again, माझं नाव मनोज रघुनाथ शहाणे. मी मुद्दामन वडिलांचं नाव स्लाइडवर लावलेलं आहे कारण he is at a stage where he does not remember me for most of the times that I meet him. And it's pretty disturbing. So let's start with discussing about dementia. So, as an introduction to dementia, when people think that everybody talks about Alzheimer's disease and they think that that is what it is, but I would like to really start with the introduction of what dementia means. Dementia is nothing but a decline in certain functions like thinking, remembering, reasoning, which is usually irreversible. We cannot really reverse it. So when we talk about dementia, it's a collection of a syndrome or a collection of a thing, not just one thing. And it covers a lot of things, including chronic memory loss, personality changes, impaired reasoning. So when we say Alzheimer's, it's just one part of the dementia. So there are many different kind of dementias, and not all dementias are Alzheimer's dementia. So in today's topic, we are just going to generalize all different kind of dementia. We are not going to talk about one part of just one kind of dementia, which is Alzheimer's. But if you look at the general population, Alzheimer's does cover about 60 to 70% of population with dementia, while the other 40% or 30% is very unknown, small portion of different causes that may cause this dementia. So how do you kind of find out early signs of dementia? So when you talk about early signs, and this is not a very deep slide, this everybody can pretty much look at this slide and judge for themselves what I'm going to talk about is you see if you or anybody that you know is having certain amount of memory loss. They forget certain things about places, people, events. I met somebody, I just cannot remember the name of, like मी अनगाशी बोललो परवा आणि like I'm trying to remember me कोणाशी बोललो आणि then I'm trying to figure out I know who Anaga is, but I just cannot place that name in my head at that period of time. So that's what it's a combination of a memory loss. We are confused about certain places, certain people, certain events. Look, we are doing this katta today, and sometimes like next week, you think, I think आपण मागच्या आठवड्यात काहीतरी बघितलं something related to that. Was that last week? Was that few months ago? That kind of confusion about places, events, that adds to certain changes like misplacing items. चाव्या कुठे ठेवल्या? We kept the keys somewhere. I kept my phone. Now I don't remember where my phone is. There is some changes like speech, writing changes, where when my father used to sign the check, the sign started changing. The signature started changing. The speech started changing. You start getting a little bit of a visual image changes. Like you see things differently than what you used to see. You'd have some kind of altered judgment. Like you kind of sometimes trying to walk, you see a step, but you miss the step sometimes. It's not something to do with something more sinister, but that may be the part of early signs of dementia. You cannot really solve problems. Trying to add things together. You're trying to do some basic math, and you really used to do that really well. I know a lot of people who are accountants, chartered accountants, CPAs, and now they start getting the dementia. They start losing that skill of adding that math. And simple math problem become difficult sometimes. Sometimes when you see this personality or mood changes, विचित्र वागतात किंवा you get angry. Most of the times these people start getting angry for no reason. And you ask them a question, they start, getting mad at you for simple questions. Why, मला जेवायला द्या, give me some food. And if you say to them that, oh, you just ate, and they get very mad, that are you trying not to feed me? मला तुम्ही जेवायला देणार नाहीयेत का? But I ate just now. No, I don't remember that. So these kind of things start happening with their personality changes, their mood changes. And that kind of boils down to social changes. So what happens is these people start kind of staying on their own. They don't communicate with people. If चार लोक घरी आले तर my father used to go and sit in a room by himself. So initially you kind of difficult to kind of understand that maybe you're not feeling good, but no, they don't want to interact with people. They don't want to talk to people because they don't have too much fuel within themselves to talk to people, because sometimes they remember people, sometimes they don't remember people, sometimes they kind of remember older things. So these kind of early signs are to be looked at when you kind of look at this dementia. What are the risk factors for Alzheimer's? And again, I'm going to use Alzheimer's for dementia because people kind of relate all dementias to Alzheimer's. So let's not get into the whole scientific names of it. Current Alzheimer's is a very common name. And just so that people get some perspective historically, Alzheimer was the name of a scientist who actually found this disease. His name was Louis Alzheimer, and he found this disease in 1906. So it's been going on for more than more than 100 years now. And even then, after 100 plus years, we really don't have real cure for this disease. So that's why I am trying to come here and trying to talk about certain aspects of it, because we don't really have a cure for it. So what do we do about it? So certain risk factors, right? So most of these cases you see in 65 years and above. As you go, as the man evolves, the years that you can get dementia may change over a period of time. But at this point in time, it's about 65 years and age. So there is a small piece of information I would like to give here is there is a very rare condition that is early onset Alzheimer's, or somebody who gets really rapid dementia at age of 40 or 50. And we are not going to talk about that today because that's a disease by itself. That's very poor outcome. So if somebody out there who is getting these signs and symptoms of dementia at age of 40 or 50, please be very serious about it. Go and see your doctor quickly because that's something that is very different of a disease, and we are not going to talk about that today. We are talking about uh, the older onset, the older age dementia, and how to kind of tackle that. Most of this Alzheimer's do run in family. So there's a family history, and when you look at it, it's usually the first degree family. So when your parents, your father or your mother has Alzheimer's, like my father does, should I be concerned? Should I be worried? Yes, I should be very much worried about it. Is there a genetic factor to it? There is a certain amount of genes. It's called APOE4 gene. And if you have that gene, um, sometimes when you see the wide spectrum Alzheimer's disease, about 25% of the patients do have these genes in them. Ata, if you have that gene, should you run to the hills? No, you shouldn't. Just having that gene doesn't mean you're going to have Alzheimer's. More than 50 to 60% of these people with this gene never get dementia, never have any issues throughout their life. So don't worry if you have that gene. How do you know you have that gene? You actually can do a simple blood test. Um, I do not know for sure where you have to go to get the blood test for now, but the blood test, Karun, you can actually get to know if you have this gene in your blood. So kind of just to be on the safer side. What are the other simple risk factors that you may actually guess is hypertension or blood pressure? Because what happens is if you do not treat your blood pressure for a period of time, your blood flow in the brain gets lesser and lesser over a period of time. And a chronic hypertension, manje, if you have blood pressure for a very long period of time and you're not treating it equally well or adequately, your brain actually shrinks over a period of time because your blood vessels get thicker and thicker and you get less and less oxygen going to your brain. What are the other few other factors? Obviously, smoking, obesity, and diabetes. We will go over that a little bit later in the discussion. And traumatic brain injuries. And you don't have to be athlete to get head trauma. तुम्ही दरवाजातनं जाताय, तुमचं डोकं आपटलं, तुम्ही सारखे गाडीत बसता, you get in the car and you're bending your head and you're hitting your head. And if this happens all the time, people who are on a bike hit their head sometimes, like bicycle, that does cause significant amount of risk factor for dementia. And the funny anecdote that when I was doing some research, I found that if you have fewer years of formal education, and I'm hoping that most of our Indian community who is in America or whoever is listening abroad is is actually well educated. So what they have found out that if you have high school dropout, you have higher chances of dementia. If you go to college, the risk goes down. If you go to postgrad courses, the risk goes down even further. So longer the college education, I think they have found out that the dementia risk is reduced. So that's actually, for the kids out there, for the parents who have younger kids, you should definitely recommend people to get educated. Like I'm sure we all do. We are all tiger moms and tiger dads. So we always push our kids to educate themselves higher and higher. So I think that helps in terms of dementia at least. Um, so when I said that earlier, is that there is no cure for dementia at this point, that none of us know at this point. There are a lot of studies going on, there are a lot of research going on, and I'm very proud to say to you guys that a lot of research in North America, in US, for Alzheimer's is done by a lot of Indian scientists. There are, I think, Alzheimer's Association lead physician is an Indian guy. There are tons of other Indian doctors across the field, Johns Hopkins. There is a lot of NIH research going on. There is a lot of research going on in California for Alzheimer's. There is a lot of research going on in Mayo. And a lot of these research scientists, majority or at least a big chunk of them are Indian. So I'm very proud of that. that Indian community is doing their part in trying to get this big monster item out there, trying to tackle it very effectively. So how do we help the dementia? So what I have done is I've divided into kind of three sections, whereas you can do risk reduction, you can do early detection and diagnosis, and then if you have it, then how do you kind of deal with safety and quality care for these patients? So this is a very interesting slide that I came across. I don't own this slide, obviously, but I found it. It's open on in the internet somewhere. Is if you look at this slide, it's very interesting way of looking at it. And when you're looking at birth and death, and when you are looking for majority of the part, if you look at this, if you say upon the 60 years ite and ite 100 years just hypothetically say that, so about majority of portion of your life you are trying to get the risk reduction. So it's very important for all of us to kind of focus on the risk reduction more than the early diagnosis and treatment and the safety and quality care, because this is pre-symptomatic. That means that you actually are not have any symptoms of dementia. So what they have shown is, and there are a bunch of research out there. There are people who have these genes, like I talked about. How do you know that you can avoid dementia? Is by actually preventing it by reducing the risk of this dementia. And we'll talk about how to reduce it. And it's very helpful and beneficial for all of us to kind of look at it and change or modify our lifestyle, modify our diet, modify our exercises, and kind of help ourselves to improve our brain health. So we're going to talk about risk reduction now, right? Because that's a majority. आपल्या हातात जे आता आहे ते फक्त हेच आहे. It's risk reduction. If you can reduce our risk of dementia for the future, if you are 20 years old, 30 years old, 40 years old, 50 years old, 60 years old, we still have this choice. If you are beyond 65 and you already have dementia, the chances of reducing the risk is less, but it still helps, right? So we have divided this into lifestyle modification, diet, exercise, and mental health. So let's go over lifestyle modification. So a couple of these slides are going to be very busy, but they're very interesting, right? So when I talk about it, um, lifestyle modification. So when you look at lifestyle modification, you are looking at different aspect of your lifestyle, right? So in US, everybody parties, everybody does things. So I'm not trying to put people on the spot, but there are a lot of research. I've looked at a lot of these, and there are a lot of research out there that kind of helps making your lifestyle better. So being active is the biggest part of the lifestyle, right? You have to be active. So active lifestyle versus sitting at the desk, working on a computer, major difference. So active lifestyle is definitely recommended. मला हे तुम्हाला सांगायला नको, obviously, that is no brainer. Active lifestyle is the biggest key to your brain health also. And I will talk about a little more details for that later. Let's look at couple of other things, right? When we all party, we intake alcohol. What alcohol, there is a kind of research out there that to me, manal ki, a glass of wine is good for you. There have been studies out there which tell you that glass of wine, they say 2 glasses of wine for men and 1 glass of wine for women every day. It helps, your health. But we are talking about brain health today. We're not talking about heart health. So I looked at a lot of research out there, and what majority of them tell you is you cannot or should not exceed 14 drinks a week for men and 7 drinks. That's a lot still. So less alcohol is better. No alcohol is even better for the brain health. But if you do drink, I just want to give you kind of a ballpark what it looks like. So 14 drinks, what does that mean? So one drink, if you call, 12 ounce of beer or 5 ounce of wine or 1.5 ounce of, vodka, whiskey and all that stuff. So that's what one drink is. And the biggest detractor when it's put in the red is no binge drinking. So what that means is if you take 4 drinks at one time in one sitting, and if you do it twice a month, your risk of dementia is more than double. And don't get me wrong, it's most probably not because of dementia like Alzheimer's, but this is mainly because of alcohol that does change your brain function over a period of time. If you do this on regular basis, if you go, do social drinking once in a while, once a week or something of that sort, that will not change your risk of getting dementia. But if you do this brain binge drinking, that definitely does affect your chances of getting dementia. We talk about high blood pressure and diabetes before, but let's talk about it a little more depth, right? Control blood pressure, as I said before, the blood pressure thickens your blood vessels. They become जाड्या होतात त्या blood vessels and they get harder and harder. So that's why when the blood goes through it, it has to go with increased pressure. So that's why your pressure is high. So as those vessels get thicker, the brain vessels get thicker too. The amount of blood going to the brain reduces over a period of time. The oxygen going to brain reduces over a period of time, and the brain itself starts shrinking. So what happens then? So we didn't talk about that, and I don't want to bore you to death with like a why does this happen? So it's simplistically dementia is caused because of collection of protein. And there are two proteins, which amyloid and tau. These two proteins kind of create all the havoc in the brain. Over a period of time, they accumulate slowly. So thoda sludge, thoda asa they around your brain cells, these things start accumulating. And as they accumulate, it gets worse, the brain functions start deteriorating. And that's why you start forgetting things. So that's what dementia is. So what this does is lack of oxygen increases the protein around that brain cells, increases the inflammation around the brain cells. And that's why you get more and more dementia. Diabetes, the increased sugar does something similar. It increases the chances of infection. Uh, it decreases the insulin, and it does the same thing. So it also affects the brain the similar way. So what else can you do to improve your lifestyle? And these are funny quotes. I have found that you use a computer a day, about 51 minutes is a research out there that if you do that, पूर्वी लोक म्हणायचे use read magazine, do this, do that. They have found out if you kind of surf computer, do something meaningful on a computer for 51 minutes or longer, your chances of getting dementia are less. If you are if you have a confidant, spouse, anybody who lives with you, you talk to them. Obviously, this is a no-brainer too, right? You talk to them, you're socially interacting with them, you talk about the world, culture, you talk about political scenario in US all the time. That helps you keep yourself active in terms of your brain function. They have found out actually if you become more conscientious. So I'm sure people would wonder what has that to do with brain function. So being more conscientious, manje, I find most of the Indians are being more conscientious is more assertive, more sure of what you want to do, more structured, more educated, more planning, more focused on goals. You have a plan and you execute the plan. You don't just kind of do things randomly. You have a plan going with everything. So I think being conscientious, and there are studies out there that people who are more conscientious, more smart, structured, have less chances of getting dementia. And then let's look at some other things. Uh, you know, don't get fat at 40. Usually what happens is between age of 40 and 50, you start getting your BMI goes higher, which is body mass index. You start getting putting on some weight, especially around the waist. And they have research that found out that if you do that, if you do get a little, you know, higher weight at that 40s or 50s, your risk of dementia at 65 or 70s twice than what it would be if you don't have that weight on you. If you have gum diseases, आपण जर स्वतःच्या, you don't go to your dentist on a regular basis. You're forgetting to check on your gums. If you have periodontal disease, म्हणजे gum disease, the risk of getting the dementia is about 4 times, because what the research have shown is that if you get infection, the teeth infection, it actually goes to brain in a smaller quantity, and those bacteria actually make the dementia worse. If you have hearing loss by itself will not cause dementia. But if you do have hearing loss, treat it. Change your lifestyle. Don't just ignore it. Go to your ENT, get your hearing aid, treat it, because there are higher chances of increased dementia if you have hearing loss. You speak another language, which we all do, it helps. The brain functions better if you speak multiple languages. If you take heartburn medication, and a lot of Indian folks eat a lot of spicy food, they have a lot of heartburn, especially the proton pump inhibitor, म्हणजे Nexium, Prilosec. These two medications you have to be very careful about because they have been linked with a chronic use with increased dementia. So if you are on them, go find your doctor, go to your GI, try to wean yourself off of it. There are different ways of weaning yourself off, and that will help you. If you are worrying about air you breathe, especially in most of our neighborhoods, that's not an issue, but there have been studies out there that have shown that increased air pollution, breathing air which is not with a high AQI, म्हणजे, air quality index, has caused increased amount of dementia. I don't think most of us need to worry about it in North America, but if you are out there where there is a lot of pollution, you have to be careful. Getting good sleep. They have done some studies that too less of a sleep and also too long of a sleep is not good for you. Because if you have less than 5 hours of sleep or more than 8 hours of sleep or 8 or 9 hours of sleep, have increased risk of cognitive function loss. म्हणजे, if you cannot, cognitive function is when you are thinking, I'm picking up this cup or picking up this phone and I'm doing it correctly. Over a period of time, that connection, that cognition of things kind of start messing up a little bit if you have too much of sleep or too little of sleep. If you have, obviously, avoid smoking. Apan bollo magashi, we talked about it. 14% of all Alzheimer's cases are linked to smoking. So definitely smoking is bad. Increased smoking, not only for primary smokers, but secondary smokers, is also increased risk of dementia. If you restrict your TV, activity to about 4 hours a day, that have shown to reduce the risk of dementia. A lot of people talk about brain stimulating. I got some messages on Facebook. What about brain stimulating activities? We'll talk about that later a little bit. But brain stimulating activities don't have to be apps or certain money. You don't have to spend money on apps to get that done. You can do regular brain stimulating activities like doing quizzes, reading books, talking to people. Kind of think about creating some exercise where you talk about things that you are not comfortable with. You create new dialogues, you create new topics of discussion. Let's not shy away from all that. So that actually helps reducing your chances of lifestyle. So I know most of us, we keep on talking about the diet and food. So and this is again, just so that you guys know, this is not all that you can do for lifestyle modification. These are some of the tips I can fit on one slide. We can keep on talking about lifestyle modification for hours, but I wouldn't want to do that. So let's go over to the diet. And if you go over to the diet, obviously everybody knows antioxidants, right? Antioxidant is the crux of half of these slides, things on the slide here. So I just want to kind of update you or educate you a little bit on what is antioxidant, right? आपण सगळेजण, we just keep on talking, oh, that's great antioxidant. Antioxidant has become a very familiar name, like almost everybody else that we talk about. Oh, we should take a lot of antioxidants. So I'm just going to quickly talk to you about what happens. Why is it important? So when some people say oxygen is great, but it's not good. So what happens is we breathe oxygen every day, 24/7. When oxygen comes into the body, other than doing good things, it also does a lot of bad things, right? It creates chemicals called as free radicals. And those free radicals eventually affect our cells in the body, with the brain cells too. So aging over a period of time, we don't live for 250 years because oxygen actually kills us and it makes us live at the same time, right? So the oxidation that is causing all those free radicals. So how do you fix those free radicals is by antioxidants. So what you eat them, what they do is they go attack all these chemicals that are in the body and they kill them, they dissolve them, they make them go away, and they improve the oxygen, available oxygen for the tissue. So basically, it helps us reduce all those bad chemicals or bad things in our body that has been formed because of the oxygen. So most of these things on the slide here, right? Let's look at the let's look at berries, right? The biggest berry that people talk about, a lot of berries, all the berries, strawberries, blueberries, raspberries, um, all these berries have very high level of antioxidant. Everything that is dark, right? Dark leafy vegetable. Dark berries are all dark. So anything that you can buy which is dark in the store has got a lot of antioxidant. A diet full of antioxidant is very good for your brain. More antioxidants you take helps you reduce your proteins that are in the body, in the brain mainly, and reduce the risk of dementia. Okay, so this is all diet that is going to reduce your risk for dementia if you start early enough in your lifestyle, which is very good. So that's why it's very important to understand why it is important. They have isolated one of the berries which is much higher, which is blueberry. So to a point where older folks who don't like berries, they actually are trying to give them powdered blueberry powder, mix it with water, drink it, and so on and so forth. So it's very important. What about the spices? So they have looked into, we'll talk about turmeric separately, but we talk about cinnamon. Cinnamon is known to reduce blood sugar, that a lot of people know. In our Ayurvedic culture, we got talk about turmeric, cinnamon, nutmeg, and the Western culture is now almost aligned with that. Is cinnamon helps reduce the blood sugar, vis-a-vis helps reduce the bad stuff from the brain, helps dementia. Nutmeg does the same thing. We'll talk about turmeric slightly separately. Omega 3 is basically those DHA or omega 3 आपण गोळ्या बघतो Costco मधनं you get like a big bottle. Highly recommend that. It's good for everyone, especially people who are vegetarian and who don't like salmon, who don't like certain amount of fish like tuna, sardines, mackerel that I have written down on the bottom of the slide here. But all these fish, especially fatty fish, have high omega 3. And what omega 3 does is the same thing. Brain functions a lot better on omega 3 because omega 3 or it's called DHA is got it's one of the brain fuel. It part of brain to begin with. So it helps brain function better. You get some omega 3 in flax seeds and walnuts and so on and so forth. So if you don't eat fish, you also can get omega 3, but you can get a pill on that. Coconut oil, olive oil, these things have certain polyphenols, म्हणतात त्याला. They also improve your brain function by reducing the chance of dementia. Like I told you earlier, leafy green किंवा cruciferous veggies म्हणतात त्याला. म्हणजे cauliflower, broccoli, all this like a sprouted things. Brussels sprouts are part of them. You can look at the chickpeas, green peas, kidney beans, all these greens and legumes, whole grains like oat, brown rice, quinoa. All these things kind of help. They have high antioxidant and they reduce the chances of dementia. What about chicken? Obviously, not fried, but they have said it's kind of weird research out there that too much chicken is not good, too less of a chicken is not good, red meat is not great. So what they have come up with is poultry, which is chicken, is in a small portion, like one serving a day, helps a lot, reduce the risk of dementia. Um, let's look at certain other element that, especially vegetarians and certain people who are low on vitamin B12, right? So vitamin B12 चं काय होतं माहिती आहे का? Vitamin B12, as you get older, like 50 plus, your body actually cannot absorb vitamin B12. So if you are 50 or 65 years old and you are eating a lot of vitamin B12 full of food, it cannot absorb it. So that's why there is a lot of people with deficient B12 as you get older. So that's why you need a supplement of vitamin B12. And there is a very small tidbit. It's very anecdotal, but there is a thing called homocysteine. Um, as you get older, when you do a lot of blood work, people sometimes do that level of homocysteine, and they have found out that जर तुमच्या blood मध्ये and this is not common, this is rare again, but I wanted to put it out there. If you have high homocysteine levels in your blood, they would recommend you to get definite supplement B12 because it helps reduce your homocysteine, which in effect makes your dementia worse. When they have looked at older people, especially, I'm not talking about young age, I'm talking about 65, 70 years old, they have recommended if you go down on your calories to 1600 and change instead of very high or very low, that kind of helps you improve your insulin in your body and reduce your risk of dementia. Let's talk about certain other aspect of cooking, right? So, आपण जेव्हा if you see those cooking show with high flame, high broil thing, that is not really good for you. If you cook something on a very high heat, and if you do like fried bacon, it's not good for you. Microwave bacon is better because let's not go into details of it, but people who want to try, look at Google and web and find out the thing called AGES, which is basically those are some kind of um, kind of molecules that are created by super high heat cooking. So super high heat frying of bacon, French fries. What is better, French fries or boiled or steamed potato? Steamed potato. Why? Because French fries have that high AGES, AGES. So these molecules actually make your brain health worse. They can make your dementia worse. That if you keep on eating French fries every day, hypothetically, the chances of dementia may be higher because of these molecules that are created. So cooking in a longer, lower temperature with a moist heat is better. I'm not recommending microwave cooking, but microwave cooking is better than frying in a very high heat. As per the research, I am no good cook at all. My wife will tell you I've never entered kitchen, but this is, from the research, I found out that this actually helps. Couple of things are very interesting, chili peppers, jalapenos, mircha, green peppers, anything which is spicy is amazing. They actually have done a study on Chinese people uh, who eat a lot of chilies every day, like 2 to 3 portions every day. And they did that mini mental exam for them for memory. And people who had more chilies fared better on mini mental remembering test than people who didn't have chilies. So because chilies have this thing called capsaicin, right? A lot of people look at that capsaicin number, that bhut jalokia or jalapeno has higher number. So that molecule, capsaicin, actually helps reduce those bad proteins and improves the brain health. Same thing with dark chocolate. Everybody knows that. Just be careful that dark chocolate with sugar and with fat, you have to be careful. So make sure that you get your dark chocolate, but not too much of sugar with it. Obviously, people who are coffee addicts like myself, great. 3 cups of coffee, as you can manage your sleep and manage your GI system and reflux and all that stuff. That's very helpful. Green tea, black tea also has caffeine to a certain extent, so that's great for you. Um, this is there is a Marathi. I'm actually do not recollect his name. It's a Pimpalkar नावाचा एक माणूस आहे क्लिव्हलंड मध्ये, I think. He's a research scientist for dementia. And I was reading one of his article, and he started with "I eat curry. I'm Indian." So that is very interesting, right? Because curry, like we said, turmeric at the top, has got what's called curcumin. The turmeric is the main part of, so it's called curcumin, and the curcumin has shown to have been a very great antioxidant. म्हणून आपण लहानपणी त्या आपल्या जखमेवर लगेच हळद लावायचो. And that used to help because that has antioxidant, anti-infective, and a lot of other qualities that are very helpful. So when you make curry, is good for you. Just the kind of a tidbit there. Yellow curry is the only thing that helps, not the red curry, not the green curry, and all that stuff. So kind of yellow because it's turmeric, so that's very helpful. Um, I was looking at eggs. There is jury is still out there on eggs because I couldn't. I'm not a research scientist, but I looked at a lot of things, and eggs are questionable at this point. A little bit of eggs are good. There were a lot of studies that too many eggs had caused lot increased heart attacks. too less of an egg was not good for brain function. So I don't really know at this point की eggs आपण कुठल्या bucket मध्ये ठेवायचे, good का bad. पण at the bottom line, I think 1 to 3 eggs a week is helpful for brain function, but not in excess. Um, we talked about fish. Like they say for brain health, go on Mediterranean diet. Eat fish day in and day out. Eat fish. I mean, I cannot, but people who can actually live on fish, that's definite. 3 to 5 times a week, having fish, especially like salmon, tuna, sardines, mackerel, not tilapia, right? Because all these fish, just it's called fatty fish, have high omega 3s. But the fish that like tilapia and others, which are non-fatty, they don't have omega 3 in it. They have very less amount. So I would rather recommend baking, obviously, because frying is not, everybody knows that. I don't have to preach to the choir here. Watch your iron. लहानपणापासून, right? If you are anemic, younger kids get more anemic. So watch their anemia. If they have low hemoglobin, low oxygen to brain, not good, right? So that's the equation. But at the same time, high iron, especially what happens is, if you're, त्यांनी म्हटलंय the research मध्ये, की if you're 18 years and older, male, or if you're adult, don't just take iron supplements. Ugitsas. Don't take iron supplements if you don't need them. Don't bump your iron too high. That's not good for you, but that creates more problem with the brain sometimes. So don't just do that. They also have recommended if you're cooking your pasta and all that stuff in iron skillets, be mindful of that. So don't use that. Don't over consume iron over a period of time. So that will not help you. So just be careful with keeping your iron level normal, not high, no low. And then last but not the least is they have done some research studies with grapefruit juices on older people with dementia. And if they drank a couple of cups of these grapefruit juices, the real juices, not just added sugar or preservative ones, their memory suddenly got a little better temporarily. So they have found out that dark fruit juices like cranberry, pomegranate, obviously you know that because of antioxidant, and that dark grape juice is good for you in moderation, obviously, because you have to look at the calories, but not with the added sugar. So again, is this end all be all for all the diet thing that we're going to talk about today? No, there is tons of things you can research online, antioxidant, other things. But this I found that was kind of a little concise, small kind of tidbit that you can look into as this is recorded and see what is in there that can give you a good chance of covering this over a period of time for decades and help you in a long-term basis. If you can look at exercise, right? As you get older, obviously, me तुम्हाला सांगायला नको किंवा this is not something that we need to go over. I'm just going to go over it quickly. Daily exercise, 75 minutes a week at least of minimum brisk exercise. The research, at least I'll tell you that they have shown that 10 minutes or longer is needed every day to affect a change. Not that you should only exercise for 10 minutes, but daily exercise. Again, check your waist circumferences at age of 40s and 50s. That's where triples the risk. Pot belly in the middle ages doubles the risk. I'm just showing you what the research shows that so that you know what to look for. You change your lifestyle in spite of age. If you have never done a single exercise in your life and now you're 55, start it today or tomorrow. It's never too late. It's always helps reduce the risk. So in general, all kind of exercises, and if you don't kind of go like my friend does, all marathons, like Anaga said, now you want to do 5Ks. Is that the only thing? No. Swim, hike, jog, sport, garden, any of that every week, at least 75 minutes will help you reduce the risk of dementia. Okay, change your lifestyle in spite of age. Like I said, if you didn't do it before, just do that. If you want to play pickleball, start pickleball because a lot of people are playing pickleball, at least in Jersey. Start pickleball. That's fine. Anything that helps you get out of the house or get out of your desk, walk around, do things, walk your dogs, whatever it needs. Just keep on moving. If you move, It'll help you. And then I found out something. This is not something that I know. I found out from my research, and it's very interesting, and all Indians should be proud of this. Is I found out that there is a meditation technique called Kirtan Kriya. And I'm not expert at that at all. I do not have any kind of personal um, benefit or any benefit of telling this to you, but I found this that actually very interesting that if you do this Kirtan Kriya for 12 minutes a day for 8 weeks, actually it's shown to reverse memory loss, which is very unique. I have not seen a lot of things out there that can actually help reverse memory loss. I do not know how good it is, but I looked at that. I've attached a link on that, which is also on Prevention website, which is 12-minute exercise a day. Please look into yourself if you are something that can help. If you like something of that sort, and exercise it on your own will. Again, please tell me, give me some feedback. If you do it, I don't, but if you do it, let me know how that helped you or if it didn't. Um, Again, at the end of the day, work on both familiar and novel exercises. So don't just listen to somebody and do treadmill just because they are doing it. Do what works for you. And at the end of the day, and this is especially true for older people, as they get older, they can't eat so much. If they cannot eat, they get too thin. And that's also a problem, especially at the old age. If you get too frail, if your protein intake is low, and if your BMI, which is body mass index, goes very low, those people have higher risk of dementia again. So just keep in mind a couple of these few tidbits. Um, Mental health, we don't really need to focus a lot because everybody knows uh, if you reduce your anxiety, treat your depression, stay optimistic, reduce your stress, be positive, don't sweat the small stuff. I don't need to tell you that, but scientifically, I can tell you that this is proven, and the research has proven that all these things can help reduce dementia, or at least onset of dementia, reduce the risk of dementia. And then one thing that I wanted to put out there that is very interesting is make yourself useful to others. And I'm not trying to change the culture. I'm not trying to tell people what to do in their lifestyle, but people who help others actually have proven that these people have less risk of dementia. Don't know why, but that's what has been proven. So, and people like Anaga and the whole Marathi Vishwa team has always been trying to help others. So I think you have added bonus for doing this, Anaga and everybody else. Like you can help others and help yourself doing that, right? So I think that's something that is there. I want to throw in some random things that people maybe one person out there who's listening may understand it, may benefit from it, and these are important. These are some scientific things, so don't go too crazy over it. There is a thing called ankle test. Basically, what they do is they check तुमच्या हातात ब्लड किती जात आहे आणि तुमच्या अँकल मध्ये ब्लड किती जात आहे. सो दॅट इज अ इंडिकेटर ऑफ इफ युअर blood is going circulating well in your body, and if it's low, that's a higher risk, because obviously that means that your brain may get less blood sometimes, and that is higher risk for dementia. So as you get older, people do that, especially people with high blood pressure should check that. It's called ankle test. People who get older, and pardon me if this is because of COVID, so it's nothing to do with COVID. If you have abnormal smell, if your taste is the smell uh, goes away as you get older, be on the lookout. Go to your doctor. Make sure that that's not just higher risk of dementia concurrent with higher risk of losing the smell, the sniff test. If somebody out there has what's called atrial fibrillation, which is the heart arrhythmia, which people take medication for, it's a chronic condition. If you have that, you have twice the risk of dementia. So be on the lookout. Use your lifestyle modification more if you have atrial fibrillation than if you don't. Insomnia pills, right? Pills like, I've written down all Advil PM, Aleve PM, Tylenol PM. These are all what the drug's called anticholinergic. It's a drug. It's a kind of a drug. Um, it's a pharmacological name for a class of drug called anticholinergics, which has part of the insomnia pills or anti-anxiety pills. These actually make the dementia worse. So don't you overuse it. Don't take every night Benadryl. People who do that, I know some people who take Benadryl every night to go to sleep. Do not do that. That's not a good idea. Like I said, avoid reflux medication for the thing. And especially for menopausal women, there is a lot of research going out there with the dementia. And what they have recommended is if you have the onset of menopause and if you take estrogen patch right away, your risk of dementia reduces significantly. Not by the oral pills, not by the hormone replacement, but the patch. If you wait for 5 or more years after menopause starts and then you start patch, the risk still exists. So what they have done is the onset of menopause and the estrogen patch together exactly at the same time has shown significantly to reduce the risk of dementia. So these are some random medical tidbits. I'm not claiming that it would be very useful for everybody, but I felt like I should talk about that. um, there is not a lot of treatment, obviously. So what do? Early signs, medical tests. I'm not going to go over that. Find your doctor, ask them what are good tests. There are cognitive functional behavioral tests that can help you diagnose it. There is brain imaging that can differentiate between Alzheimer's with versus non-Alzheimer's. There are some medications, brand new ones, like shiny top of the class medication that reverse the protein formation in the brain. Still out there, the jury is out there. They help, they don't help. Go to your doctor, they'll tell you. There are other medications that will help you with anti-anxiety, antidepressants, other things that can help you. There are medications like vitamins, B12, omega things I talked about. Those who help. Um, Special, therapies. My wife actually, Seema, is an occupational therapist, and she's not next to me right now, but they play a big part in assessing the safety, the physical skill set of the Alzheimer's or dementia patient so that they stay active, fit, and safe. Physical therapy improves the balance, reduces the fall. There are a lot of therapies out there that are new. Jury is still out there. They do it. Some people boast it that is end all be all. Music, art, pet therapy, validation therapies. There is thing called reality orientation that, there are a lot of experimental therapy. You can, if you have somebody who is really significant patient of Alzheimer's or dementia already, and you don't know what to do, you can be part of the trials. There are a lot of trials. Go on www.alz.org, and there is a thing there called Trial Match. You click on it, you can enter in one of the trials that they're doing. They also have something which is 24-hour hotline, and the number is in there. You can find it on Google. You don't have to write it down right now. But there are so many things that are going out right now. And at the end of the day, right now we are only 1% there. If there is 99% things that are out there are still not known, and this is all 1%. So what do you do? If you have, like my father has it, unfortunately, I'm away from him. But my mother, my sister, they take very good care of him. How do you help these patients, right? And this is we are coming to the end of our discussion today. Um, but you create a calmer place with a low background noise. You create a clean, clutterless surrounding. You check for obvious physical reasons like hunger. They sometimes cannot tell you that they're hungry because they ate something. Sometimes they are very cold, but they cannot really express it. You create an exercise routine for them. And this is mainly for caregiving tips. Okay. So this is for if you are next to them, you're living with them, you want somebody to help them. If you have a caretaker who comes and helps them, make sure that they look at all these things. There is thing called sundowning, right? When we talk about sundowning and many other aspects, but these Alzheimer's or dementia patients get a lot of sundowning. In the evening, they get very frazzled. They don't know what to do. The light is changing. They get confused. They sometimes leave the house. They go around randomly, start walking. Watch that. Use music, dance, painting, pets as your helpers. Use low lighting, night lights to avoid confusion at night because they don't really sleep through the nights well. Wake up in the middle of night. They need some light. They cannot get confused. You use calm, composed demeanor despite of frustration that you may have. Make sure give medications on time and carefully. Don't give them wrong medication because sometimes they take their own medication by mistake. They don't know what they're taking. Keep them safe. Consider GPS device, especially in US. There are a lot of GPS devices that have come for Alzheimer's that actually help if they get lost. Remove the access to car keys, especially if they have advanced dementia, because they sometimes forget that they cannot drive so well. And they just go in the car and start driving. Make sure that you avoid caregiver fatigue. And that happens. I see that in my mom, my sister, because unfortunately I cannot help them, but they are there 24/7. And when a family member next to the patient of dementia, they get really, really fatigued and frustrated. They need a break. So make sure that you get breaks. Make sure you get help. Make sure you spend money to get help because that helps a lot. And then at the end, these patients may forget what you said because they don't remember things, but they will not forget how you made them feel. So always love them, care for them, right? So at the end of this topic today, what I would really point out to you is what is dementia prevention? Because prevention is something that almost does it guarantee prevention? No, it doesn't guarantee prevention, but it reduces the risk. It can make you better understand dementia and you can support dementia patient better. So what it does is it helps you understand that this is a big disease. And even after eating all the spicy stuff and all the chilies and all the antioxidant in Indian culture, even then, the dementia in India, at least now, is rising at a very rapid pace, just like US. So the whole world is, as we all get older, the amount of dementia that you're going to see is much higher. So as a community, as providers, as doctors, as listeners, if we don't educate people on this, within 10, 20, 30, 40, 50 years, we're going to get a lot of people with dementia, unfortunately, because, unless we do something about it. And that's the whole reason for me to kind of come to you guys and talk to you about it, even though it's very brief. It's an hour and change today that we talked about. And at the end of the conversation, um, I do get emotional about this because I see that every time I see my father, the empty stares, the forgetting the names. Every day is a new day. So what I would part today and end the discussion and the chat with a small poem, and I'll really like to read it to you because it's really really touching. And the best part is we don't know who wrote it, right? So it says, "Do not ask me to remember. Don't try to make me understand. Let me rest and know you are with me. Kiss my cheek and hold my hand. I'm confused beyond concept. I'm sad and sick and lost. All I know is what I need you, that I need you, to be with me at all cost. Do not lose your patience with me. Do not scold or curse or cry. I can't help the way I'm acting, can be different though I try. Just remember that I need you, that the best of me is gone. Please don't fail to stand beside me. Love me till my life is done." And with that, I hope I could give you at least, 1% of some information for dementia, for early kind of look at what can happen, how you can help it to a certain extent if you can. So thank you again, Anaga and Marathi Vishwa, for giving me this opportunity to come in this 2024 and start with a very um, thoughtful topic that hopefully will help the community everywhere in North America and the rest of the world. Thanks, Anaga.
Thank you, Manoj. Thank you very much. This was really very insightful. Uh, yeah, I had read your Facebook post, like you mentioned, you were wishing your father happy birthday. And it really struck me at that time that even if you wish, he doesn't know that
Mhm.
it is his son who's wishing him happy birthday, right? So
Mhm.
it struck
Mhm.
a chord. And definitely whatever you spoke about today, it's it's how you live. That's what you were talking about.
Mhm. Mhm.
Um, those are, I think, the principles for living, and put in a very nice medical term also. So thank you very much. I think लोकांना खूप आवडला असेल, आणि I'm very sure I'm going to get a ton of emails saying they
Yeah.
want to have some questions answered. But I just wanted to repeat that again to everybody. Please consult your own physician.
Mhm.
Please consult your neurologist, not
Mhm.
neurosurgeon,
Neurologist, correct.
neurologist, because you need to get that conversation rolling, and you need to make that relationship very quickly in life to combat something else. And Manoj, your time was also very valuable, and I know slide deck was extremely informative. I learned a lot today, and thank you for taking that time, patience to do this. I know आपलं नोव्हेंबर पासून बोलणं चालू होतं जरा, पण खूप गोष्टी होत्या ज्या मला खरंच माहित नव्हत्या. तर ते आता कळल्याने, आणि एस्पेशली ट्रॉमॅटिक brain injury. I slipped and fell on ice 2 years back, and they did they did a scan, and मला आता that reminds me that last year I forgot to go and get a scan, so I have to go and get a scan again. So those are the things that you have to keep up with, basically, just to make sure that there are no changes. Pet therapy, I think definitely I can vouch for that. I know you have a dog, and
Mhm.
pets increase the value of your life a lot,
Mhm.
and they take you out for walks. They take you out. You don't
Yeah.
go. You don't take your pet. You the pet takes you out. आणि मला खरंच 2-3 वर्ष त्याचाही खूप अनुभव आलेला आहे. You become much more heart healthy. I really think about what I'm eating today just because I have a dog. खरंच कुठल्या तरी प्राण्याला मारून खायचं मला अजिबात आता चालतच नाही आजकाल म्हणजे. So, but whatever you spoke today really did make a lot of difference, not only to me, and I'm very sure to everybody listening in today. So I would like to thank you. Annie, I'm very sure MV Club 55 will come knocking on your door. I will also talk to them. I think we should continue this conversation in some shape and form ahead of time. Any last words you want to say?
No,
And
I
then,
mean, I really would like to thank you guys because मराठी विश्व does a lot of, we always assume that आपण मराठी विश्वकडनं आपण नाटकं करू किंवा जे आम्ही करतोच, I do that. That's part of my other life, which is theater. But and that's entertainment, that's some kind of education. But I think हा भाग खूप महत्वाचा आहे. You are connecting with the Marathi population and non-Marathi population for that matter to come up with something which is like a community katta is very, very informative. And not just because I'm here, you will have more people come, more people talk, and that's very nice, and that's very, very comment. I commend you guys on having that courage to educate people. And I saw that slide that you had created. You said educate, and um, right. So that
yeah,
right. So that is something that is very, very nice that as a community you guys can bring forth. And I'll be more than happy to connect with you or anybody else in the future. Not
okay,
only for same thing, but we have a lot of a lot of smart, intelligent people in the community of all
right,
different kind of doctors, different kind of research scientists. We should keep on continuing this community talk, community katta, in a bigger forum nationally. And I think I would definitely recommend you guys to continue with that. So thank you so much for the opportunity again. It is
thank
my pleasure. Every word I spoke was from the heart. Please, again, go talk to your doctor if you need to. But I think most of the lifestyle thing, diet thing is very generic. You can find out if I said anything wrong, and I'm very sorry if there is a mistake that I made during the talk, because I did my research as much as I could, but I'm just one person. So you are all out there. Please come back with comments, concerns, questions, and we'll continue with this in the future. But Anaga, thank you so much for the opportunity and the time.
Thank you. Thank you, everybody.
Have
Thank
a
you.
good day. Happy New Year again.